Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. If you've ever suffered from depression or know someone who has, then you'll want to know about the study published in the June 2016 edition of the American Journal of Psychiatry. In recent years, a number of clinical trials have shown that taking certain supplements in conjunction with antidepressant drugs can actually enhance the efficacy of antidepressant drugs and improve outcomes for patients suffering from depression. This means that adding specific supplements to their antidepressant medicine regime has been shown to speed up recovery time, improve responses in patients who were previously not responding to their medication, or provide a more complete recovery and/or reduce relapse rates. Now, this is important because overall, only 30 to 40% of patients with major depression have only a partial response to the use of antidepressant drugs and psychotherapy treatment when you factor in relapse rates. Now, in a combined effort, researchers from the University of Melbourne and researchers from Harvard University examined 40 clinical human trials worldwide, alongside a systematic review of the evidence examining the use of supplements as an adjunct to the treatment of depression. Now, after reviewing all the worldwide studies performed up to December 2015, they published their findings in the June 2016 issue of the American Journal of Psychiatry. Now, what they discovered was that the current research supports the addition of certain supplements in the treatment of depression alongside antidepressant drugs, as it can increase the effectiveness of antidepressants for people with clinical depression. This was especially true for 4 specific supplements, including omega-3 fats from fish oil, SAMe, which is also known as S-adenosylmethionine, methylfolate, which is a form of the B vitamin folic acid, and vitamin D. Each of these supplements boost the effectiveness of antidepressant medication. Now, the strongest evidence was for omega-3 fats from fish oil. See, the brain requires omega-3 fats to improve what's known as the brain fluidity. With improved brain fluidity, the receptors on the brain cells can more easily receive signals from the feel-good brain chemicals like serotonin, dopamine, and norepinephrine. Now, antidepressant drugs help the brain increase levels of these mood-enhancing chemicals, but brain cells need to have sufficient fluidity for their receptors or antennas to receive these messages from these mood enhancers. If the brain hardens, which can result from eating too much saturated fat or trans fats or not having enough omega-3 fats in your diet, then the brain cell receptors are much less effective. Everything's more rigid. So omega-3 fats have been shown to improve the effectiveness of antidepressant drugs by improving brain fluidity. But omega-3 fat supplements also help to decrease brain inflammation, improve blood flow flowing through the brain's blood vessel network, and it may improve nerve conduction so the brain cells can communicate with each other more effectively. And some studies show that omega-3 fats help to prevent the buildup of beta-amyloid plaque, which is a hallmark feature of Alzheimer's disease. Some studies suggest that having omega-3 fats reduces risk of Alzheimer's disease. So omega-3 fat supplementation from fish oil is a supplement to really strongly consider here. Now, the supplements SAMe and methylfolate work by helping the brain synthesize more of these mood-enhancing chemicals, serotonin, dopamine, noradrenaline. You see, antidepressant drugs slow down the breakdown of these mood-enhancing drugs, but only certain supplements like SAMe and methylfolate can actually help the brain synthesize more of these mood-enhancing chemicals. As for vitamin D, studies show that vitamin D is required to help the brain make serotonin, which is the ultimate feel-good brain chemical or neurotransmitter. My point here is that many doctors don't read the American Journal of Psychiatry every single month, and so many doctors may not see this groundbreaking review paper. So if you suffer from depression, or you've suffered from depression in the past, you may want to forward a link to this research to your family doctor or your specialist. Or you may want to provide the link to this research article to a friend or family member who suffers from depression so they can forward it to their doctor. Hopefully your doctor or their doctor will review the evidence and recommend an established daily dosage of one or more of these supplements highlighted in this review as a means to increase the effectiveness of antidepressant medications. I've attached a link to the research article and review in the text below to make it convenient for you. So I hope you found this helpful and informative, and I'll see you next time.